Welcome, everybody. I am so excited to be here with you today. My name is Sandi Scheinbaum, and I am here with Elyse. We are founders of FMCA, and this is an opportunity for you to ask questions about anything that may be on your mind as it pertains to our program at FMCA, as well as what is potentially the field of health coaching all about. What's the scope of practice? Questions that you might have on your mind. We are here to answer those for you. And before we get started with the formal Q&A period, I want to share a really exciting development that is a major milestone for the field of health and wellness coaching. It was just announced that our field has a taxonomy code that will become effective April 1st of this year. Why is this important? A taxonomy code, taxonomy is a classification system. And now health and wellness coaching has a number. We have that identifier. Why is this important? Because it will allow you, when you become a health and wellness coach, to have your unique NPI number. NPI stands for National Provider Identifier. And if you are going to be working for a medical practice, you're going to be entering notes in electronic medical records. This would be important. And then we are also on a trajectory for billing insurance with what's called a CPT code. So putting this together, the recognition that we have now this NPI number, plus the significant movement that is taking place that is putting health and wellness coaching on the map for billing insurance. And we are thankful for the National Board, Health and Wellness Coaching, for working so hard to get these very significant accomplishments in place. And we're fortunate at FMCA that we worked very hard to be an approved school through the National Board. And what does that mean for you? And that means that you can, as a graduate, can sit for their exam. And as a board certified health and wellness coaching, you will be the one that is allowed to use these codes. So there are exciting things happening in the field as a whole. The field is just exploding right now. There's an energy that's palpable. So with that, we will get started with our Q&A portion. And let me just advance the slide. So just something that you should know, and that is we have a new class coming up. There's a lot of excitement at FMCA because there are new students who are coming in from all over the world. And today we want to know what's on your mind. And so Elyse can explain a little bit further about using the Q&A in Zoom to answer your questions, to submit your questions. And then we hope that you will join us. And these are just a few of our students. One of the times when we were live, our live summit, we hope that we will have another opportunity to have all of you together live. And now it's time for our Q&A portion, and Elyse will share with you how that's going to work.
Thanks, Sandi, and good morning, good afternoon, good evening to all of you who are watching live and those of you who are going to be watching the recording. I see some of the attendees, and I've spoken with you on the phone or via email, so it's great to connect with all of you. And thank you for submitting your questions and taking the time to be with us today. So as Sandi had mentioned, so many exciting things happening in the field right now. And we will proceed with the question and answer. Some of you have submitted some questions as well. So before we dig in and and start answering some of the questions. You can start gathering some of your thoughts and your questions. You can go ahead and click. There's a little button at the bottom, and it looks like a little chat box. So just click that. It says chat, and you can open that up. And I believe Kelly Ann has already posted a question, and you can, way to go, Kelly Ann. You can go ahead and just follow suit and post your questions in there. So we will take questions from the chat. And if there's a little bit of some space, we'll go over to some questions that have already been pre-submitted. So I am super excited. We're both excited to be here to answer your questions and serve you. And if for whatever reason your question does not get answered or doesn't get answered fully, we'll share with you how you can reach out and connect further with one of our amazing admissions team members. So I hope that that's clear. And if there's any questions, you can put those in the chat. So back to you, Sandi.
Yes, so I am looking at Kellyanne's question. Great question. Share about job opportunities. Let me answer that one first. So many opportunities. Let me just describe where those might be. So there are medical practices that are increasing numbers realizing the benefits of having a health coach. It is my mission to go out there and educate practitioners about the value. I just gave a talk for the Institute for Functional Medicine. They're our collaboration partners. And so because we are the only school that has this relationship with an organization like IFM, they train the doctors. And so we are part and parcel with their program. In other words, I speak from their stages, now virtual stages, and their faculty are our faculty. And so their trainees, these are the doctors training in functional medicine, they are being educated from the get-go the importance of having a coach in their functional medicine practice. We also have a lot of people who are waking up in what we would call the allopathic or conventional world and realizing the need for coaches, and they are hiring coaches. And then there are very unique organizations like James Maskell's organization, Find Functional. They are exclusively hiring FMCA coaches. And so will the certification be usable within a clinical atmosphere? Most definitely. And because you will have now an NPI number, then as well as the recognition that there's more and more evidence of the effectiveness of health coaching. Again, more and more are hiring. There's also companies who are having coaching as part of a membership. For example, Fitbit. If you have a smartwatch, you have a membership and you can have a health coach. There are big companies who are now hiring coaches as well.
Yeah, absolutely. And a lot of our graduates are beginning to work in a clinical atmosphere and beyond. So there's so many opportunities out there, Kelly Ann. And Alyssa asks, how many times a year does the program start? So we have 2 start dates, and we are currently in our enrollment period for our March 2021 class. Our class officially starts March 1st. We will close enrollment for this March class February 16th. So it's coming up really soon. And then our next class will not start until September. And we will typically open up enrollment a few months prior to that. So great question. Carrie, this is a question probably for Sandi. Your website mentions an emphasis on scope when it comes to health coaching, scope of practice. Can you please explain what that scope covers?
Scope of practice means what is, it originally came from a licensed provider. So what is within your legal scope? So if you are, for example, you're a pharmacist, you're a dietitian, you are a healthcare practitioner, you have a scope of practice. And when it's extended to health coaching, it's a really important topic, one that I take very seriously. And so first and foremost, I would like you to see scope of practice as so many ways that you can work as a health coach. And you have a very unique area. The scope of practice of a health coach is as a behavior change advocate, a behavior change specialist, somebody who is trained in how to help people access intrinsic motivation so that they could move forward and have their work on their health goals. And when we think of scope of practice, many people think of it in a restrictive way. And what would that mean? Well, I think that you would understand that health coaches are not medical doctors. You didn't go to medical school. And so you would not go out there and you wouldn't diagnose a medical condition or treat medical condition. You wouldn't have a prescription pad if you were a health coach. Just like when I was a psychologist for many, many years, I didn't have a prescription pad to write those scripts. For example, I didn't order labs. That was out of my scope of practice. So health coaches, we consider then what is your profession. And for the scope of practice definition, we turn again to the National Board of Health and Wellness Coaching. And this is the ability to partner with people to really be their ally on their journey towards health. And it is not involving prescribing medication, for example, or making direct recommendations about supplements or labs. But there is also the potential to educate. And that is something I'm so passionate, and we really work with our graduates to inspire them to be out there and really educating people about the functional medicine, for example. And so you can, as a health coach, certainly go out and give talks, write books. You can have group programs where you're providing education. And so at FMCA, we work really hard to make sure that everybody who graduates firmly understands all that you can do with your scope of practice and in a way that you will be safe, so that you will be able to really influence many, many lives by your scope of practice. So I hope that answers your question, and we are happy to talk about it further if you still have questions. Let's see. And then
Ray Watkins asked, how will the practical face-to-face training portion of the certification be done?
This is done remotely, and it is done just as we're on Zoom now. And you will have sessions that are an hour and a half, or actually they're 2 hours now. And the reason is they are so really what we say is the secret sauce to having a program that can help you to become confident, effective coaches. And it's where you are in a small group. And within that group, you are learning to be a coach. You get an opportunity to practice coach with your peers. There's use of breakout rooms, and we require these sessions, and so does the National Board for Health and Wellness Coaching, because they want to see that we have what's called synchronous learning, and it's experiential. And something else happens in these sessions that's magical, and that is this personal transformation takes place where you grow as an individual as well as being a coach. So this is the key part of our program. They are led by course facilitators. These are experienced mentor coaches, people who have gone through our program, and now they are on our team.
And I would just add to that, the live training sessions, from what we've heard from our students and graduates, are the secret sauce. That is just what makes them feel so confident after they leave the program to go on and coach. And Caitlin asks a great question. What are the opportunities for private coaching practice, or for example, setting up your own coaching business?
The sky's the limit. It really depends on you. If you are excited by the possibility of starting a business and you are wanting to do this, we will fully support you. We have now a complete business building track. It's part of the program. There's no extra fees involved. And it starts at the 9th month of our 12-month program. And we encourage you to go out there, and it's very, very successful if you start by discovering who you want to serve. And there are many examples. So I could share so many of them, of people who have gone out and created successful businesses. So there's many opportunities. Coaching is just in its infancy right now. And so many people have gone out and they have created a great business around the world. I'm thinking of Susie in the UK, and she's called Peppermint Wellness. You can look her up. And she started a podcast. She has interviewed great people to be on her podcast, many influencers. She has a thriving practice. We have people who've written books as part of their business. We have people who are going out in the community. They are doing group classes and programs, and of course, the one-on-one coaching. And we support you with that. Both Elyse and I love to do this type of mentoring. We have office hours where you can come to those, whether you are a student and then staying on as a member of our alumni program. And you can have access to us as well as a lot of other business mentors who come on and help you to start your business and grow it.
Yeah, absolutely. I would just second the sky is the limit. There are so many possibilities. And I would even encourage you to ask yourself that question is what would really light you up? So many of our graduates come from different backgrounds and have different passions. They're multi-passionate and they blend those together. So there are just so many different ways. We have graduates who are going back into schools, going into corporate, starting, podcasts, like Sandi said, just doing some really phenomenal work. So there's so many different opportunities there. Allison, hello, Allison. Allison's from Tennessee, and she writes in, could you speak to the success rate that FMCA graduates without any medical background have had in terms of getting hired by functional medicine practitioners?
Yes, so we have a lot of people who come to us and they don't have a background in healthcare, and they often make better coaches because they don't start out as the expert, as a healthcare practitioner, and they're passionate about this work. And therefore, that passion comes across when they are going out to be hired. And I speak to a lot of doctors, a lot of functional medicine doctors, and they want somebody, first and foremost, who's aligned with the mission of the practice. They are also, in many cases, loving people who come to their practices who bring what we're calling secondary skills. What might those be? Well, perhaps you have experience or you yourself are comfortable with social media, with going out and giving talks for the practice, starting groups for that practice. And so your background will be an asset. And so one of the things that we emphasize is no matter what you did in your previous life before becoming a health coach, it will be valuable. And so perhaps it's marketing, perhaps it's working in corporate. You bring that to the practice, how you organize, how you manage. And so there are no barriers to people who are coming in. And we hear from our alumni department that this is, sometimes people will come posting a job description and they don't know, and they think, should I have a health coach or nutritionist? Well, maybe I'll have someone with both backgrounds, for example. But by the end of the conversation with somebody in our alumni department, they realize that really the key is the health coach. And so they have shifted their perspective. And so I would not let that be an obstacle. And to specifically answer your question, I'm not sure the exact percentage because the data is continually shifting, but we have not heard that it was a tremendous barrier. Again, it has to do with your mindset. So if you are going into a practice and you are sharing your value, then that is the key. So your mission aligned with the practice is number one.
Absolutely. The second part of that question is, do you have any sense of the range in salary one could expect as a board certified health coach in a private practice?
Sure. So by private practice, I'm not sure if you mean that you are working for somebody's private practice or you are setting up your own business as a board certified health coach. So of course, in the latter example, you would not be on salary. You would be your own. You'd be an entrepreneur. And I'd like to share something from my good friend and mentor, JJ Virgin, who talks a lot about encouraging. She works with a lot of people, helping them to build their healthcare business. And often they don't value themselves. They may have imposter syndrome, or they feel squeamish about charging for what they do and really claiming their worth. And she encourages them, some people who've been in business for a while, to raise their rates. And guess what? No one complains. In fact, their business doubles or triples. They get more people coming on. So that's number one. If you're referring to, what the rate is, you would, it's a range, and sometimes it's trial and error. You see what would work. The average, if you have your own business as a coach, it could be depending on what community you want to serve. So that's first and foremost. So it might be, if you're serving an underserved population and running groups, you might have, your fees might be less. Perhaps it would be $50 an hour, $75 an hour for your one-on-one. And then up from there, perhaps you are serving a different population and you would charge, their coaches charging $150 or even more. Again, if you're coaching high-level executives, there might be a higher fee. What about if you are working in a practice? And so there, the average, if you think about the rate that it's comparable to what, for example, a nutritionist, dietitian, it might be starting at $75 an hour, it might be a little higher, but there are also different ways that practices are onboarding coaches. So salary is one, but we're seeing a lot of models where it's an independent contractor arrangement, and then you are receiving a percentage of what the business, the practice, collects from the patient. Another variable to take into consideration is whether it's an insurance or a cash-based practice or a membership, a concierge type practice. So I guess the answer is it's all over the place. And it's really, what do you want and who do you want to serve? That would really determine the salary or the rates.
I hope that answers your question, Allison. Thank you. And Elizabeth says hello. She's curious to know if there are internship opportunities, not necessarily paid, or job shadowing opportunities as part of the program to take advantage of during the year.
We don't have a formal internship program. We encourage you to start practicing your coaching skills. First, while you're a student, there are ways that you can connect with your peers. You can start with just trying out the coach approach with friends, for example. And then when you graduate, one of the requirements for the NBHWC, the national board, to sit for the exam is you have to have 50 hours that you have logged of sessions. And so many people will seek, perhaps not formal internships, but they will have arrangements where they will go in and they will volunteer. And so if there's an organization that you know of, if there's a place that you are very interested in, then as soon as you enroll, you can start to approach that group. And if you come to my office hours, I will walk you through the procedure in how to do that.
And there's another part of that question. Elizabeth is asking, so are there opportunities to connect with alumni of the program to learn more about their experience post-graduation? And the answer is absolutely. We would be happy to support you with that. So what my encouragement would be is to email us at, and anyone can do this, email us at admissions@functionalmedicinecoaching.org, and we can certainly connect you with a couple of graduates who would be willing to speak and share their experience. So great question. Thank you. So Tony, hi Tony, is asking how much time would I need to allow per week to complete the course?
Sure. So it varies. It depends on what type of a learner you are. But generally, it may be an average of 10, 15 hours a week. And within that year, sometimes it might be a little more or less. We have all types of learners. Some people might be primarily auditory and they would just listen to some of the materials while they're taking a walk, for example. We have others who like to just look at everything and take careful notes and write everything down. And so that might be a little longer. But we have, I would say, just about all of our students are working. They are often raising families. They have other obligations. We've had people working 2 jobs and spend their year with us, and they work, they find a way to make it work. And that's one of the things we emphasize for everybody, and that is helping them to look at how they're going to manage their time while they're with us.
Absolutely. I hope, Tony, that answered your question. And Kelly Ann is asking, what are the continuing education requirements after graduation?
So we as a school don't have continuing education requirements. We offer a certificate of completion. If you choose to become board certified, which we highly recommend, then they have requirements for continuing education. So your board certification must be renewed every 3 years. As a school, we offer those opportunities through our specialty courses, through membership in the alumni program. We have a lot of trainings that are ways that you can get your continuing education credits for the board.
And so Ray asks, does the FMCA help with information on liability insurance after being board certified?
Absolutely. So we recommend that you get liability insurance as soon as you start to coach, even when you are doing your law, before you are board certified. And that liability insurance, we have in our resource library, we have names of insurance companies, carriers who offer this insurance to coaches. And it's on par with if you were a yoga teacher, and many of our students and graduates have that background, or Pilates instructor, personal trainer, you would get that liability coverage. And so many of these, it's on par in terms of the cost of that coverage.
So, and Caitlin is asking, so other programs are much shorter time-wise. Can you speak to the year time commitment?
Yeah, so we have been called by others the gold standard in health coaching. And so we are focusing on the journey that you take from when you enter to graduating to feel that you are a competent, confident coach. And so we believe firmly that a deep dive is going to serve you better than speeding through a program and coming out and finding, I'm kind of at a loss here. I'm in over my head, or I'm feeling insecure. We want you to feel that you are ready. And so that's why we have our core curriculum. And then we also have our business building track. That's optional. We encourage everyone to go through it because it is going to prepare you not only to work if you choose to set up your own business, but also how to get your foot in the door of medical practices, how to work in that environment, HIPAA compliance, all the things you would need to know. And so it's a lot. This is a serious profession. As one of our teachers in the business track says, this is a profession and not a hobby. And to prepare for a profession, you want to be taken seriously out in the world. And we're really proud. That's why we have doctors who are telling people when they're approached, I only hire FMCA grads.
And we are seeing that more and more, which is a really cool thing to see. So Tony's asking, are there breaks in the program during the year, such as at holidays? Yes, we get a lot of people who take vacations. Sandi, do you want to speak to that, or I can as well?
Yeah, so you are an adult learner and you set your own schedule. So we don't have a formal vacation. We're not a brick and mortar building where you come to school and then school's out for a holiday. But as people who work on our team, we observe those holidays for them. We wouldn't schedule any live training session on a holiday, for example. And we have many people who have, again, very, very busy lives, and they may have a vacation. And so you plan around it. And when you sign up for your live training sessions, you choose a slot that will be, I can make this, and a day and a time that would fit with your schedule.
Absolutely. And you receive the content on a monthly basis. So you're able to work through that content pretty much at your own pace, minus the live training sessions. So what a lot of people do, if they know they have a break coming up or a vacation or something life related, they will maybe, work a little bit harder at the beginning of the month to get through the content so that they can be prepared and come to their live training sessions. So I hope that answers your question, Tony. And feel free, I'm going to move over to the other questions that we received, but still feel free to add questions to the chat and I will come back to those. So Jacqueline is asking, what's the level of English required to participate in FMCA?
Yeah, we have a global community. And so the fact that you wrote that question shows that you have a good level of English. So we have many people who are where English might not be their first language, and they do really, really well. So I would not let that be a barrier.
Agreed. We have people from all around the world. So if you are particularly interested in learning a little bit more about what that might look like, I encourage you and everyone else to reach out to admissions, and we can have you speak with an admissions team member to answer your question. Another question that is coming in is, and there was quite a number of questions written around this, so we can answer quite a few with this, but what sets FMCA apart from others? I'm exploring different programs, so I really want to know.
First and foremost is our collaboration with the Institute for Functional Medicine. If you're not familiar with IFM, they are the gold standard in education for practitioners in functional medicine. I went through the program in 2010 and was certified in 2013. And this is for practitioners, primarily medical doctors. And so FMCA wasn't around then. If I, as a psychologist, if FMCA was an option, that was the route I would have taken. But the IFM is a program that trains practitioners, and what sets us apart is our partnership, our collaboration. What does that mean? It means that we are really aligned with them to teach people going through their program the value of having a health coach alongside them when they are becoming functional medicine practitioners. And it also means that our curriculum is their curriculum as far as the functional medicine and functional nutrition pieces. And so that means there's senior faculty, Dr. Joel Evans, Dr. Patrick Hanaway, people who are really key in teaching through IFM, teach for us. And it's the same slides even. Some of them are modified so that it is more appropriate for coaches as opposed to what a medical doctor might need. But you are getting the same material. Now, what does that mean for you when you are going out, say you want to work with functional medicine doctors? Well, you speak the same language. If they know, this coach from FMCA is going to know about the functional medicine IFM food plans. They're going to know about the matrix and the timeline and all the other resources from IFM. And so that's really, really key. We are also in terms of our connection with the national board. So FMCA is considered one of the founding schools. We were one of the first that was approved for board certification. And so I'm part of working diligently with the director of NBHWC and other leaders in coaching to move the field forward. We are also, we are also we developed this model of integrating functional medicine with positive psychology and mind-body medicine. This way of looking at what are these areas that are so important for coaches to know. So we are not just a school that will teach you motivational interviewing and throw it in with some unique theories, but we are evidence-based. So we take all of the areas of our curriculum and we ask, is there evidence for this? So we don't teach anything that is just one person's theory, but it is really based on the functional medicine research, positive psychology research, mind-body medicine research, and psychology of eating as well. That's my baby. I used to teach courses in psychology of eating and love to teach that part.
And just to add to that, I would say we have an amazing, wonderful global community of like-minded individuals. So you are going to be in good hands. There's a lot of support in the program. Sandi had mentioned that we offer office hours. So we are very involved and we love to support you along the way. And it's just a very positive, uplifting community to be a part of. People end up making lifelong friendships and relationships and potentially even business partnerships. So there's just a lot of really awesome things that happen. So I hope that answered your question. And then Kellyanne is, speaking of positive psychology, Sandi, and the psychology of eating, can you share a little bit about the partnership that we have with the University of Western States?
Sure. Well, that was the school that I taught at. I taught psychology of well-being. I taught mind-body medicine, co-taught it with Dr. Deanna Minnick, who happens to be on our faculty. And we have if somebody has been at UWS, and then they can come in to our program. And then but the main arrangement is that if some people choose to go on UWS, for anyone who doesn't know, they offer a master's in human nutrition and functional medicine. And so if our students want to go on to get that master's degree, they can come into their program with some elective credits already fulfilled because they have trained with us in our certificate program.
So Caitlin writes in, will non-functional medicine doctors consider hiring a coach from this program?
Yes, there are many more and more. And I'm out there diligently speaking about the importance of coaching, and also that functional medicine coaches can be a way for these doctors to bring functional medicine to their practice. And so many of them are choosing to do that as a first step to bring functional medicine to their patients. It's you are bringing the education and those principles, and primarily the diet and lifestyle pieces. So yes, we are seeing that more and more.
Absolutely. And Daniel writes in, I live in Tucson, so kind of similar to where Sandy lives, not aware of many doctors that are working in functional medicine. How would Daniel go about finding someone to partner with?
Well, if this was 5 years ago, we would say, that would be challenging, but not anymore. Telehealth is here to stay. And as a health coach, you have the whole world that you can people to reach out to. So the beauty of being a health coach is that you can work across state lines. Licensed providers cannot. If I'm a licensed doctor in Massachusetts, I can't see somebody in California, for example. It would be a violation of my license. But health coaches are not what's called covered entities. They are not licensed providers, so they are not bound by those state licensing regulations. So you can do telehealth with anybody. And many doctors, I was on a panel last night, and we were learning how many doctors now are getting coaches so that they can maintain the integrity of their license. So they might still be seeing their patients in Massachusetts, but they can be growing group programs, for example, and their coach is now coaching people who are across state lines. So I would not be discouraged. I would reach out to people that are out of state or out of your area. But I would not dismiss your local area, because functional medicine is growing rapidly. And IFM's conferences are sold out. And so more and more doctors are getting trained in this approach.
Absolutely. And just another resource for you, you can always go to ifm.org, and there's a find a practitioner if you're looking to specifically work with a functional medicine practitioner in your area. So that's a great resource to reach out to. There was a question that came in regarding corporate wellness, and if we can speak to graduates who go on to work in corporate wellness. So do we have any fun stories to share about that, Sandy?
So it's another growing area. And many people who have some connection. So we have an example is somebody who came in, she was a lawyer, and she'd worked with a firm, and now she's going to pursue her passion. And so she trained with us. She started coaching on the side while still continuing in her law firm. And I remember she was in my office hours, and she was super excited because her firm had wanted her to come into like a lunch and learn. So she did that. It was very well received. And then she started to replicate that with other firms. So word of mouth, and she had colleagues in other firms. And so she built up a program for lawyers for health coaching. And a program specifically for legal practices. And so I would say that there's, again, it's another area where the sky's the limit. And perhaps you look at, who do I want to serve? And if I want to serve community who are in corporate, then you look at what relationships do I have? How can I make connections? And I know that there's tremendous need and demand by companies for furthering the health of their employees. And so we, again, through our office hours, through our business mentoring program, business building track, will help you, walk you through that, and be able to launch that.
Okay, so another question came in about starting the program, and if for whatever reason you're not wanting to continue, can you quit the program? Is there any last date? We do have a withdraw and a deferral policy, and I actually encourage all of you, this is on our website, it is in our many places in our info packet, and I encourage you to reach out to admissions@functionalmedicinecoaching.org if you would like to see that. But basically, up until you start the program, let's just say March 1st, that is the start of our program. Let's say that you enroll today. You have all the way up until basically March 30th to withdraw from the program. And we do have a $500 withdrawal. You would receive your full refund minus a $500 processing fee. If for some reason, we have a lot of people who join the program and life happens, let's say you're in month 3 or 6, or sometimes, 8 or 9, and you cannot continue the program at that time, what you can do is you can absolutely withdraw. However, you would not be receiving your tuition. But for a lot of people, what they choose to do is to defer, and they can defer to the next start date, up to 2 start dates after they originally enrolled in the program, and there is a deferral fee for that as well. It is $200. So I'm happy to support you and putting that information in an email for you if you'd like to see it. I know that's a lot of information, but it's a great question, and it's always nice to know what your options are up front. So thank you for asking that. Another question came in from Colleen. So how large will this next group of FMCA students be? We just actually got off a call talking about this. We're very excited. We have, we're just about at the 300 mark, and I would probably be, I'd like to be humble and say we'll probably be, around 350 to 400 students. So but you will be in this large group, but you will be in a smaller cohort. So it won't feel so big. But a way to connect with other alums and other people from different cohorts is to come to office hours. A lot of connections and networking happen there. So I encourage you to keep asking questions in the chat. I've got another one coming up, and we have about 14 minutes left. So there was a question that came in around, do you know of licensed health professionals who utilize their functional medicine coaching training in their current profession, or do they change their career completely to health coaching or a side coaching business? So for example, she's a PA in a conventional medical office, but she would love to have her own coaching practice.
Yes, all of the above. So we have people who come in and they are licensed practitioners. They might be medical doctors. We've had dentists. We have people who are nurses, for example, and many other professions, massage therapists, acupuncturists, you name it. And they are bringing the coaching skills, they are bringing the functional medicine piece. Whatever we have taught is now something that they're incorporating into what they have been doing. And then we have those who decide, okay, I'm going to wear 2 hats. I'm going to be a psychologist, and I'm going to have a coaching business. And we teach you through the process of creating an agreement. And that would be a client agreement, just showing that, yes, I'm a licensed clinical psychologist. I'm a PA, and for this purpose, I'm going to be your coach. And we teach you how to do that. And then we have many others who make the transition and they become coaches only. And all of those models are very, very doable. So I hope that answered your question.
So another question is coming in from Natalia, and she writes, can you give some examples of how your students are evaluated?
Sure. So the primary way is what we call the practical skills evaluation. So, and that is where you coach and you get feedback. And that is the most important way of being evaluated. We're not believers in the exam, the formal exam for a lot of this. You will have that when you take your board certification, but you are not going to be having midterms and final exams where you have to cram and you have to memorize all this information and spit it out on a test. I remember those days, you probably do too, and that's not what we're about. This is experience. And so you're evaluated based on that. And then there's the informal. It is when you are in your live training sessions, it's interaction and you're constantly getting support and feedback. It's not called an evaluation. It is really, you are contributing, you are giving back, you are asking for help if you need help. And so it is constantly getting that support and feedback as opposed to being evaluated. Now we do have quizzes that are optional. So you would listen to a webinar and there'll be a quiz at the end. They're not long, they're like 5-10 questions. And then you get immediate feedback whether you got that answer right or wrong. And that's a way that you can test your own learning.
Okay, so another question came in. Have we seen any successful alumni from the field of exercise physiology?
Yes, actually, we have, and we also encourage. And this is a time when, if you're a personal trainer, that industry's been disrupted. It's often tough transitioning to a remote business. And so we have many people who are becoming coaches. So exercise physiology is awesome. And being able to use that, being able to teach people, being able to study movement and exercise. That's exercise and movement is one of the modifiable lifestyle factors in the functional medicine way of thinking. And so, yes, that would definitely be something no one comes to mind right now in terms of actually use how they would like having a formal training in that. I know I've heard people like they've come to my office hours, but I'm not able to think of a specific example.
So let's see, Carrie is asking here, what if you're a graduate of the IFM practitioner program? So Sandi is, she can speak to that. Do you see their graduates coming to receive a wellness coaching certificate?
Yes, actually we do, because the IFM program is not about coaching. It is about the functional medicine way of thinking, about clinical imbalances, and what would be then the complementary training would be a very deep dive into coaching and most specifically into positive psychology. Now that was my area, and I'm passionate about that, and brought in many people to our faculty. Brian Nemec, who heads the VIA Institute on Character. We have many experts in positive psychology, and so that is not offered by IFM, and that's what we teach. So yes, that does happen.
Yeah, I just want to add, I spoke with a practitioner yesterday who's IFM certified, going through our program, about to graduate. And she just said she had such an eye-opening experience, really, really learning the coach approach. And it's been super helpful. And she's got tons of ideas for how she's going to incorporate that into her practice. So
Oh, and we have the best example, Christy Hughes.
that's
Christy.
who I was thinking of. Yes,
Oh,
you read my
yes.
mind.
All right. Well, Christy was, if you're not familiar with Christy, you will get to know her. She's one of our teachers. She was actually the first person that when we, Elyse and I went to IFM to discuss this crazy idea, let's start a school for health coaches. And would you like to be our collaboration partner for that? And Christy, like, yes, yes, yes. And she has been our advocate, but she was many years in medical leadership for IFM. She's senior faculty, and she just this year, she's graduating in a month, and she went through as a student after having so many years in functional medicine, and she used this and grew tremendously as a coach. And so yes, absolutely, that you can combine the two.
Yeah, and that's a perfect example of a medical practice that is expanding into a coaching practice, because she now has two. She is a functional medicine, will be a certified health coach, and now she already has a health coach and someone else in her practice, and her husband actually is also going through the program. So she's creating that model of coaching, which is super exciting to see. So, and then Elizabeth asks a really great question. So she's asking, trying to explain to friends and family about this, starting to embark on this field of health coaching and FMCA. And of course, there's a lot of questions about, is this really a serious profession? What's the salary look like? So she's asking for resources that could be helpful to share with friends and family without having to read through a ton of overwhelming information. Where can people learn more?
Yeah, so it depends what they would like or who they are. So if there's somebody who would be interested in the facts and figures, then you might look at the NBHWC website is a good resource. You can look at the Harvard Institute of Coaching. I'm a member, and they have resources there. If it's finances, like what does the industry look like in terms of projected to be, I think, I'm not good with numbers. I think they said it was like a 2 billion, or it's one of the trends. If you just Google like the hottest professions or the trends, there are a lot of reports that are out there about the who is which professions are projected to grow. So there's those figures, and then in terms of the one of the possibilities would be to say, like, okay, let's have this conversation like a year from now, to see if it's worth it, because there is a hidden value here. In fact, I was just talking to Alex, she's our director of student services. Just said, you know what, I hear all the time. She is the supervisor for the course facilitators. What are they reporting? People come in and they said, I came to FMCA because I wanted to be a health coach. And yes, I got that training. But now that I'm graduating, what I know is that I was transformed. I am a better person because of this. In other words, I'm more present for people in my life, and my family notices that, hey, I'm responding differently. And so that is the intangible that it might be hard for your family to get, because it's not facts and figures, but it is something that is priceless in terms of what this will do, in terms of who you are, and as you are going through the program, the changes that you will make are not just for your clients becoming a coach, but as I said, also for you and your family, your friends, your community.
And I hope, Dory, that also answered your question, and Sandy spoke to that. And we have another question, and then we're going to have to wrap up here. And the last question Hopefully this speaks to all of you. Or what are the traits of a coach? What is the most rewarding part of being a coach?
What a wonderful question to end with. A coach offers hope, compassion. A coach helps people change when change is hard. First and foremost, you listen. And listening is a form of communication that is better than speaking. It's really being with somebody and hearing them, letting them know that they are heard. And so that is something that we know that is people who come to our program have that already. And all we're doing is giving you helping you to get the more knowledge, to have the confidence to go out and really help people have healthier, better lives. Our mission, Elyse and I have a big, bold mission. We want to see a health coach in every doctor's office. We live for that, waking up to see people who we have trained go out in the world and so much impact, particularly now. And that's something that also I wanted to add. And that is the world needs you now. We have people who are suffering, and we're on a mission to train coaches who will go out and serve people who again need you now more than ever.
Absolutely. I cannot underscore that enough. And I would just like to wrap up by saying thank you so much for submitting all of your questions. If for whatever reason your question did not get answered, or you're still curious and you're wanting more information, we encourage you to reach out. We have our admissions team available to support you personally with your questions. And you can head over to our website and click contact us. And there's a variety of different ways that you can get in contact with us. I would also like to just share with you that if you are interested and you want to pursue becoming a functional medicine health coach, if this is really speaking to your heart and you can envision yourself helping others and serving others, I encourage you, and Sandi and I both encourage you, to head over to register at functionalmedicinecoaching.org, and you can utilize the promo code Y, all caps, 500. And that will provide you with $500 off enrolling in the March 2021 class. So of course, if you have any questions, please reach out. You can call us, you can email us, you can even set up an appointment to speak with an admissions team member or myself. I would love to support you and have you join our FMCA family, as we call it. So thank you once again.
Thank you all for joining us. It was a pleasure to be here and getting to know you through the chat. Bye, everybody.
Bye now.